might need to take sexual history. Okay. I will tell you when to take the sexual history and when you suspect any sexual problem related to the sexual health. What are the common presentation you will take sexual history? That's very important. I'm going to share one sketch with you guys that will cover everything related to the sexual history of male health and women health, and what you need to know. If you know that sketch, 100%, you will be able to take sexual history related questions, and in all, starting from history part, data gathering part till management. So these are the things you need to know. Before that, I'm going to show you ebook in which there is different contents. You need to understand how to use that ebook, and in that ebook you will find a one section where we are telling you different questions, like one option, second option, third option, how to take sexual history. I'm going to share my screen now. You guys will be able to see that ebook. We call it consultation structure ebook in that one, and I'm going to quickly go through that and you will understand how to use it then. Right. So basically, you're able to see that sketch as well. I'm going to open both side by side. These things, what you need to know whenever you're taking a sexual history from anyone. So these are the things you would be doing general approach to STI. If someone is, you are suspecting who's coming with sexual problem, these are the questions you will be doing that, okay? Just one. So you can see this ebook. Whenever you will start consultation related to any of the topic, this would be the common structure of doing any consultation. Let's say if you are doing this consultation, when you are going to ask sexual history, again, you would start with the structure of model consultation. You try to follow that. You will check ID, you will do ability, you will do remember setting of consultation, everything. And here, when you will got to know that you need to ask question about the sexual health, male health, this is the part here you will be asking about the systemic review. Before Meftosa, you will be asking those questions here about women health, that may be periods or anything like that, and male health, child health. You will be asking those questions here. For example, we are doing regarding the sexual history. So you will go here down in that ebook. You will find different acronyms here. You'll keep going, and you will go where you will find the section how to take the sexual history. So this is women health, this is male health. You need to identify outside the cubicle. If the patient is young male, then try to include specific questions related to the male health, including sexual health and other male personal issues. For example, patient might say problem down below, which could be STI, UTI, testicular problem, or erectile dysfunction. So you need to understand why patient is saying that. So then at that point, you will be considering confidentiality. At that point, you need to consider confidentiality. Women health is a wide topic. However, if you are seeing a woman, you should think of period, sexual health, contraceptions, pregnancy, pap smears, or a specific question in female health that should never be skipped in any consultation. So this is how you will ask about the women health, pregnancy, pap smear, trimester, how long have been pregnant, is there your first pregnancy? If not first pregnancy, ask about previous pregnancy, if any complication. Twins, multiple pregnancy, did you follow with your midwife regularly? Ask this question if it's related to that. And then menstrual history, always include menstrual history in if you are thinking of anything related to the sexual problem. Why? Because you need to know last menstruation period. If you know the last menstruation period, you will be able to understand why the patient is having that symptoms, maybe vomiting or similar to that. Explore menstrual history for all childbearing women. The menstrual history is something of a personal nature, so always signpost before asking. Let's begin by discussing your symptom, your concern, and what do you hope to accomplish today. Next, let's talk about your menstrual cycle. Would that be okay? When was the last menstrual cycle? For each period, how many days are there? What is the number of pads you have used? Did there seem to be an unusual smell? What color was it? Have you noticed anything unusual about your menstrual period? Then coming to the sexual history, that is the most important thing in that ebook. Here today, you need to know how to ask those questions. Sexual histories, patient often experience discomfort due to sexual health issue. As a result of this discomfort, symptoms may be downplayed or postponed. So that is the way that you use your interpersonal skill to tell the patient that you are here to help. The patient might say, doctor, I want to see a male doctor, male doctor. That means the male is asking for male doctor. That means there is something problem related to the male health. That then that point you would reassure that we are trained here, trained as a doctor here. For example, if you're a female doctor, we discuss all types of problems. So don't worry, we are going to help you with that. Then what you would do, you would start, you understand that, then you would say, thank you very much for coming today. Unfortunately, at the moment, I'm the female doctor here, but I want to reassure you, whatever you would be discussing with confidential, and number two, I will make you as comfortable as possible. And we are trained like that way. Not only then, how you will understand. The wide misunderstanding, always clarify patient meaning when using informal language or ambiguous terms. Not only intercourse can be considered sexual for patient, but many other activity can as well. During sexual health discussion, maintain confidentiality is a crucial. Establishing trust with the patient, identifying any potential safeguarding issues such as suicide risk or experience of sexual violence, assessing risk behavior such as use of recreational drugs and sexually transmitted disease infections such as HIV. To prevent onward transmission of infection, it is important to consider possibility of exposed partner and important. So in sexual history, always remember confidentiality, always remember partner, always remember partner notification, always remember STI, always remember screening for STI like HIV and other thing, always remember drugs. Again, confidentiality, partner notifications, STI conditions previous, and always gum clinic. Remember gum clinic. These are the most important thing. Any personal problem related to the sexual health, you always talking about these things, right? So unless you say something that, so this is the partner notifications, how you will mention, how you will approach that, what how to speak partners and everything, you will see a lot of concern like that. Should I tell my partner? Do I need to tell my wife? So these are very difficult questions. How would you answer? That's the most important thing. Unless you say something that concerns me about your safety or someone else, everything we discuss during this appointment will be confidential within our healthcare team. If that happens, I will talk to you before sharing anything. So these are the good words or lines, sentences you can tell them to reassure. I have some question about your sexual health that may feel personal to you to understand your risk of getting sexually transmitted infection. And you would say, I'm going to ask few standard questions about your sexual health. These are the questions we usually ask everyone with the similar problem like you got or similar complaint presentation you got. Please let